Hi, I'm Paola. I'm Jaime's friend.
Hi, I'm Natalie. I'm my mom's friend.
Yo soy Mari, vecina de Jaime.
Hi, I'm Namilet. I'm Miss my sister.
Mi nombre es Aurora García y soy vecina de Jaime.
All right. Thank you everybody for coming today. Let's just start off this speech today that we'll be giving by imagining having a wonderful, fulfilled life. Full of enjoyment, wonderful things, nothing but happiness and great memories. You start to feel sick over time, and we're going to skip a few months ahead. You start having all these issues health-wise. After many doctor visits and research, they come to tell you that you're faced with the fact that you're diagnosed with a terminal illness. Terminal illness meaning you're gonna die and there's no cure for whatever disease or illness you may have. No matter what treatments or medicine you take, at the end of your ordeal, you are gonna pass away. Basically saying there is no cure to help you. So what do? You decide to keep living day by day, just waiting, never knowing when will be your last day? Or do you decide to fight a defeated battle? Or do you want to come to the realization that it's something unavoidable and decide to take it in your own hands? You decide you want to take control of your life. Today I will be talking about physician-assisted suicide. Dr. Jacob Jack Kevorkian believed in just that. Even though many people had their opinions about him and his beliefs, he was proud of his choices and decisions. He supported doctor-assisted suicide. There's an article that gives a short biography of the doctor on Wikipedia. He was best known as the Death Doctor. He firmly believed in patients having the right to die. He advocated it on many occasions. Dr. Kevorkian even went to jail. He was sentenced for second-degree murder and served 8 years of a 10 to 25-year sentence, all because he decided to help somebody die by euthanasia, which is with anesthesia. Now bringing you back to this being you or a loved one, what would your decision be? Would you like to participate in every aspect possible when it comes to ending your life process? Wouldn't you like to have a choice as to when or will you will go? You have already been diagnosed with a terminal illness, disease, and you only have so many months to live, or not have any idea as to how long you have to live. Would you like to take control of yourself? When I talk about this, it's because I've worked with many terminal ill patients, people that are going to die regardless, no matter how many treatments they do, no matter what type of medicine they take, no matter which doctors they go see, they're going to die. I believe in this. I think it is not a great thing, but I think it's a personal choice and a belief, and I personally, I don't advocate it, but I stand by it. I think people have the choice. If we each our own live our life and make our decisions throughout life, why not have the choice as to how we're going to end life? Basically with this, you choose what day you're going to die, what time you're going to die, how you're going to die, where you're going to die, where it's going to take place, who's going to be there when you die. You basically take an assist in every part of how you're going to die. Many people think it's wrong because of Catholicism and because of their religions. They think that, only God should have a choice as to when you will pass. Many people think just nature should take its course in life, and they just think this is another way of suicide, even though it is not harming yourself physically as to ending your life, as far as hanging yourself, a gunshot wound, anything along those terms. Basically, it's the same as when you euthanize an animal, and many people don't believe humans should have the right to go through with this as well. When I tell you of working with terminally ill patients, those who are terminally ill are basically just do treatments to extend their daily living. When a patient refuses or no longer attends treatments, their possibility of living another day decreases, and chances of death increase. I've worked in the medical field a long time, and even though encouragement is our main focus, firsthand we see these people suffer day to day. Many lose hope and come to the realization of what awaits them. What morally right thing to do than to let these people choose how they go, choose the day, the situation, choose it all, rather than let them deteriorate till they no longer know who they are. I personally agree with this law. Like I said, I've worked with many sick people, and they're fine 1 month, and the next month they can't walk, they can't eat, they can't talk, they can't do nothing for themselves. So what this doctor encouraged was a lot of dying with dignity, which is dying with pride, knowing how you're going to die, when you're going to die, and just giving you the choice of dying before you get to the point to where you no longer can make choices and have other people making them for you. In Oregon, Washington, Vermont, New Mexico, and Montana are part of the 5 legal U.S. states to allow this law, the Death with Dignity law. Obviously, with another issue, with any other issue, there's always 2 sides to every controversy. Like I was saying earlier, people religious-wise and activists and different types of people have their opinions about whether this is right or wrong. I personally don't see an issue with it. And most certainly, with this law comes requirements that patients must meet for this to be granted. There are guidelines. Anyone attempting to have this done must meet certain criteria. There's a website giving a short idea of the Death with Dignity law on publichealth.oregon.gov. Like I said earlier, there is also a Wikipedia page on Wikipedia of Dr. Jack Kevorkian that tells about basically an autobiography about his life. This isn't a law just to where anybody that feels sick can go and try to end their life quickly. There are many requirements and like I said, criteria that you have to meet. You obviously have to go through seeing psychologists and stuff before they okay this to actually go through with what it is like you are trying to achieve. Like I said, this speech was basically just to give you an idea of this law and that it exists, and many people don't know about it, but it is out there. Like I said, 5 out of the 50 U.S. states do it, and I agree with it, and like I said, sometimes you just have to decide. You don't know until you're in that situation. That's why many people disagree with it, but until then, because I do see it firsthand from my work experience, I would vote yes on this law, and I think it's something that should be more looked into, and it's something that should be brought out to the public more, and it's something that shouldn't be kept underground so much. This does exist, this does happen, and people actually go through with it, and I think it's a nice thing that they give people the opportunity to die with dignity. I think that's the best thing you can do for a terminally ill patient. But basically, that's all I wanted to talk about today, and just mention that there is this law out there, and that that people do go through with things such as this. So thank you for coming today. And that is all.